Hello everyone. In this video, I want to talk about the written examination for the ADC exam. So, regarding the written examination, I will talk only about the very important points. So, this exam is usually conducted in partnership with Pearson View at various test centers around the world, and it is held twice a year, that is in March and September. So, regarding the written examination, if you want to know more about it, you can read the written book for general dentistry. You can download it from this site on the ADC main website, and everything about the written examination is given in this PDF. So, coming to the eligibility for a written examination is a successful, valid initial assessment. Time frame is 5 months from the application period to results released. Cost of application is 2060 Australian dollars. Validity is 3 years. And the 2024 period 1 and period 2 application time, initial assessment deadline, application period, examination date, everything is given in the site, so with the exact dates. So the when it comes to the basic things for the written examination, the main thing is you have to get a initial assessment, successful initial assessment. Then they will give a date to apply for the written examination place. Then later you have to book a written examination and then sit for your written examination and to receive the results for the written examination. So coming to the PowerPoint which I have made to make this very simple for you, this includes only the major portions. So coming to the first thing that we know is the three major steps for the ADC exam, that is the initial assessment, second is the written examination, and then comes the practical examination. So in the written examination, like I already told, the eligibility is a valid initial assessment and you should have your identification cards. Then coming to the booking process, if you meet the eligibility requirements, you can book your written examination. For that, the first step is to apply for an examination place. This we have to submit an application to the ADC. And second one is to book the examination venue, and this is done directly with Pearson View. So first thing is to make the payment, that is to the ADC. Then they will give a date when we can apply for the examination venue, that is to Pearson View. For that, mail and all they will send you, so you don't have to worry about that. I'm just going through all the steps now. So to book your examination venue with Pearson View, you'll be provided a booking window of approximately 2 weeks from the date of your authorization to test email. Some venues have limited capacity and the allocated seats in order of receipt. So, for the best chance to secure your preferred venue, the ADC recommends you book as soon as possible after receiving your authorization notification. So, once the application for the examination venue starts, please you book it very fast as soon as possible, because it had happened with me. I wanted a examination venue, but I was a little bit late, like 2 3 hours, and I was not able to get that venue, and because of that I had to travel very far to appear for the exam. So be careful with that. So now, the structure and timings of the ADC written examination. First you should know like how the ADC conducts written examination. It is conducted over a period of 2 days, and each day you will have two exams. Let's consider the first day as section 1, section 2, and the second day as section 3 and section 4. So, in each section, there will be 70 questions. This all are multiple choice questions, and these are scenario based questions. Earlier, in Australian written examinations, they used to ask some theoretical questions. Now, the part of theoretical questions is very less, like values and all. They don't ask much, and they ask more about the practical knowledge and how we apply our knowledge in the clinical setup. So, these are usually scenario based questions. Each section has 70 questions, and you will get a time period of 2 hours for your exam, and there is a rest break you can take in between the sections, because you should definitely take a, like, it's like a compulsory mandatory break that you should take in between the sections. And once you are giving a, just imagine that you are giving the section 1 and you want to go to washroom or you want to drink some water, or if it is very urgent, you can take a break in between the exam also, like while giving the exam also you can take a break. But the problem with this is that that time will be deducted from your 2 hour exam period. So like I told, 70 questions, 2 hour each, 4 exams for 2 days. This is the pattern. Now you should understand, like, for this 4 exams what they are asking you, like it's classified into 4 clusters. So you have to pass in each cluster. It's not like you have to pass in an average, no, it's like you have to pass each cluster. So first cluster is health promotion and professionalism. Second one is patient care, clinical information gathering. Third cluster is diagnosis and management planning. And fourth cluster is clinical treatment and evaluation. So in this you can see, like cluster 1 constitutes 20% of the questions, and cluster 2 and 3 30% each, and cluster 4 again 20%. So the problem with cluster 1 and cluster 4 is that you will get less number of questions. So there is a chance that you can fail in these two clusters, that is cluster 1 and cluster 4, because it constitutes only 20% of the questions. And on the left hand side you can see, like, which all category constitutes the percentage, like how much of the question percentage will be asked from particular topics. For example, it's given dental emergencies 7 percentage, endodontics 8 percentage, and general medicine. And one more thing I want to tell you is, uh, what we have studied in first year and second year, they don't ask much. Most of the conditions, or even the medical conditions which can affect the oral health, they will ask that kind of questions only. So no need for mugging up all those general pathology, microbiology. So you don't have to worry about those questions. It is mainly practical oriented exam, like practical, how you are applying your knowledge in a clinical way, clinical setup. So in the left hand side you can see the percentages. And one more thing is there. So there will be 240 scored questions, like 70 questions each, right? So 44 exams into 70 questions is like 280 questions. Out of that, 40 questions are unscored and 240 are scored. And one major problem is we won't able to understand which one is scored and which is unscored. So you have to attend all questions and there is no negative markings, and so you have to make sure you attend every question, answer every question, even if you have no idea what it is about. Just try your level best to attend all questions. Now, coming to what are the requirements for the written examination, is that you should have two forms of primary id, or one form of primary id or one form of secondary id. So this ids, usually you can take uh, your pan card or your license, anything that has your signature, because once you are entering your examination hall, you have to sign digitally and they will cross check that. So with signature with your full proper name, and the name should be same with the name that we have applied for our ADC exam. So the examples are also given, you can go through that. And now coming to the grade bandings and the description for the written examination. So all the clusters you should get either A or B. If you get a C or D for any of the clusters, then it's a fail. So grade A and B indicate a pass in the cluster, and grade C and D indicate a fail in the cluster. So grade A is a clear pass. That means your score was more than 10% above the passing score. Grade B is a close pass. That is, your score was within 10% above the passing score. And score C is a close fail. That is, your score was within 10% below the passing score. And grade D is a clear fail, that is, it was more than 10% below the passing score. So you should aim A or B at least. If you're getting a C or D, it's a fail. Then you have to appear for the written examination again. It happened with me. I gave the exam, and for one paper, I got a C, and so I have to second time I gave and I cleared in my second attempt actually. So to pass each cluster, you must meet the standard of the minimally competent recent Australian dental graduate. Okay, and how the methodology and all they have given in that PDF. So from this video, it is only about the basics of the Australian Dental Council written examination. So to understand more about it, you can go through that PDF. It is given in detail. It's like some 1920 pages are there. This is the concise version. The major important portions were covered in this one.